Hi, my name is Colette Royal, Director of McKinley Labs. I have been with geriatric for 15 years. I would like to let people know that there are better options out there to be proactive about their health. We have launched McKinley Labs in the division of McKinley Caregiver Resource Center. McKinley Labs is a resource of knowledge for caregivers and seniors to better understand throughout genetic testing indications to help determine a person's chance of developing or passing on a genetic disease. We are happy to host today's Lunch and Learn, an introduction to genetic counseling presented by Emory University's Genetic Counseling Program. I would like to introduce Lauren Lichten, Assistant Professor at Emory University. She worked as a clinical genetic counselor in maternal-fetal medicine, pediatrics, and adult neurology. Prior to joining Emory Genetic Counseling Program, in 2019, Lauren was an instructor at Boston University Program, Associate Director of Brandeis Genetic Testing Program. Thank you.
Okay, hi everyone. It's such a pleasure to be here to talk to you about genetics and genetic counseling. It's a very big topic, so certainly I would love to make this interactive. If there are specific questions you're hoping to get answered today, it'd be great if you put them in the chat so that way I can be sure to address them. I think I won't be able to see the chat once I get my slides going, but please interrupt me with questions. I want this to be as interactive as possible. So as you learned in my introduction, I'm a genetic counselor. Genetic counseling is a small profession. There's only about 5,000 genetic counselors in the United States. And I moved to Atlanta last summer to work at Emory. So currently I spend most of my time as a genetic counselor training the next generation of genetic counselors at the Emory University program. I do spend a small amount of time counseling families who are impacted by a hereditary form of ALS. I have about 15 years of experience being a genetic counselor, have worked with families in a prenatal setting, pediatrics, as well as in adult neurology. Our training as genetic counseling is across many specialties, so you'll see that I'll use many examples today. So I hope by the end of this short talk today, you'll have a better understanding of what a genetic counselor is, reasons for why someone may consider seeing a genetic counselor. Importantly, there are so few genetic counselors in the country. Not everyone may have the opportunity to see a genetic counselor when they have genetic testing, which is sort of just, you need more genetic counselors. So if you have friends, family interested in a career where you work with people and science, it's definitely a great opportunity. But that said, a lot of times when you have a genetic test, a genetic counselor may not be involved. So I'm going to hopefully provide some information about things you should consider when someone's offering you a genetic test to make sure that it's the right decision for you. So who are genetic counselors? I've already discussed that we're a small but mighty profession. We are specialists who provide information about your genetic health. Genetic counselors can work in a variety of areas. Today I'm going to focus on genetic counselors who work directly with patients and families. About half of our field works directly in patient care, whereas the other half may work in areas that impact patients, but not in a one-on-one setting. So like public health, research, or genetic testing laboratories. Our training is in both psychology and in medical genetics, which will make more sense as we get into this. It's a full-time master's degree program, which is followed by taking a board exam to become certified. And the majority, but not all states have licensure. So in Georgia, genetic counselors are licensed medical providers. We reached 5,000 genetic counselors last year. So we're on our way to 6,000. The field has actually exploded over the last 5 to 10 years. So when I did my training as a genetic counselor from 2003 to 2005, there were only 23 schools in the country that you could go to. Now there's over 50 and about 500 people per year graduating. Back when I did my training, it was probably less than 200 graduating every year. That said, there's not enough genetic counselors. There's generally about 6 jobs for every graduate. So there certainly is a need for more providers who understand genetic testing and all the nuances of it. So what areas do genetic counselors work? The areas that genetic counselors work is growing quite fast. Generally when someone's planning to have a baby or already pregnant, there's a variety of genetic tests that are offered to the expectant family. These genetic tests are actually optional. So a genetic counselor can meet with a family to help them understand the genetic risks and help them understand if this information is even something that they want. So you may have heard of screening for Down syndrome commonly being offered in pregnancy. Sometimes a genetic counselor may help a family sort through those decisions. Many genetic counselors work in pediatric setting with children or a specialized adult medical care setting. This would be with individuals who have medical or developmental issues, and they're trying to answer the question of whether a genetic reason could explain these challenges. If a diagnosis is made, sometimes genetic counselors work in specialized clinics for specific genetic conditions. So when I lived in Boston, I worked at a Huntington's disease clinic, which is a genetic disease that can affect adults, that can affect both the brain and how the body is moving. The most popular area for genetic counselors to work in now is in cancer genetics. I'll share an example of how that's relevant later. We're learning that many cancers do have an inherited component, and there's additional screening and management options that can be offered to families who have those risks in order to keep them healthy. We're still in the early stages, but similarly, we're learning that there are many genetic factors that contribute to cardiac conditions that could lead to sudden deaths or heart attacks in a family, abnormal heartbeats. So there's a whole group of genetic counselors who specialize in these conditions. And then lastly, neurology, which I've mentioned. So I'll talk a little bit more at the end about various neurologic conditions that we know have a genetic component. But there are genetic counselors who specialize in neurology, both in a pediatric and an adult setting. Our training involves education and seeing patients across the lifespan. So it's much different than, say, medical school or nurse practitioner, where you do your training in one specialty and you stay there. The training for a genetic counselor really overlaps across settings. So genetic counselors may have a history very similar to mine, where they've worked in multiple practice settings. So why would you want to consider making a genetic counseling appointment? Well, there's many reasons. One, your family member may be pregnant or thinking about becoming pregnant and are concerned about your baby's health. Your family member have been diagnosed with a genetic condition or have symptoms that could be explained by a genetic condition. You've had genetic testing and need help understanding the results, or maybe you're thinking about having genetic testing and want to know if it's a good choice for you. Is there a strong family history? So particularly cancer, neurologic conditions or heart conditions. So generally, there's a higher chance of a genetic component when there's many family members affected, and we see family members affected in a way that's atypical. So for cancer, for example, in families that have a hereditary component, oftentimes we see people having a history of more than one cancer type, or they're getting cancer at a very early age, before 50. With neurologic conditions, maybe you're seeing a pattern in the family with many people with neurologic conditions, and again, maybe earlier than you would expect, like dementia occurring at a much earlier age in the 50s or 60s, as opposed to the 80s when it's quite common. With heart conditions, so this would be heart conditions that aren't explained otherwise. We know that there are lots of environmental factors that can lead to heart conditions, but there are some families that have a very strong genetic component. So if you go to a genetic counselor, what happens during an appointment? So now due to COVID, but also in times before COVID, genetic counselors can work in a variety of ways. So there's genetic counselors that work in medical centers where you would go in person and make an appointment with them and meet face to face. However, telemedicine is a growing practice method for many genetic counselors that existed prior to COVID, and I imagine will increase when the pandemic is finally under control. So now geography isn't a limiting factor to setting up an appointment, as there are many genetic counselors who are working through telemedicine. Regardless of which way you meet with a genetic counselor, the flow of the appointment tends to cover certain things. So the first thing you'll notice is that either before the appointment or during the appointment, they'll ask you lots of questions about your family. And this is really important because now genetic testing is all over. You can just buy it on Amazon, or, you know, there's many options out there, but actually the most useful tool to predict your genetic risk is a good family history. And so by asking your family members, and by family members, I would mean anyone from you to your children, your brothers, sisters, nieces, nephews, cousins, aunts, uncles, grandparents, asking questions about major medical problems, if they've had genetic testing, all that can be very useful. And the genetic counselor may tailor the questions to the reason for appointment. So if you're seeing a cancer genetic counselor, they would want to know about people who've had cancer and what types of screening people have been having for cancer, like their mammograms or their colonoscopies. In a neurology setting, they may ask questions about people who've had various imaging, like MRIs or CT scans, history of dementia, trouble walking, so with frequent falls, psychiatric conditions. So the questions may vary in terms of setting, but family history is always extremely helpful to know about. And then based upon the information that a genetic counselor has, whether that's your family history, your health history, previous genetic testing, the genetic counselor may discuss possible risk factors to you. And so it could be that the outcome of this conversation is that actually you don't have any significant risk factors, and that genetic testing may not be that helpful to you. But many times there may be something that you could choose to do to give you more information about your risk. And a lot of times that may be a genetic test. Sometimes it's a procedure to get more information. So maybe that's a mammogram or an ultrasound, etc. And so oftentimes the decision, however, is should I have this genetic test? The genetic counselor will discuss what that test is, what it can tell you, what would the impact of this test be in terms of your health? Are there certain things you can do to keep yourself healthy? So for many genetic conditions, there's not yet treatment, but for some conditions, we know there's things that someone can do to keep themselves healthy. Genetic counselors, our training is in both the science, but communication and dealing with emotions. So anytime you're talking about genetics, you're talking about your whole family, and talking about family can bring up emotions, baseline, but thinking about a condition impacting you as well as other family members can also be quite emotional. So genetic counselors are trained in helping people think about those things and cope with the emotional aspects of doing genetic testing. Genetic counselors are also expert in finding information about rare conditions. So it can be very helpful for families to have appropriate support groups or resources at their fingertips. We all have access to Google, but we all know that there's some information out there that's not correct, and some places are more helpful than others to go. So genetic counselor can certainly be a helpful point person in helping your family navigate a situation involving your genetic health. And then this picture here, I don't know if anyone's seen that before, but basically genetic counselors will draw a picture of your family tree using these circles and squares and collections of lines called a pedigree. So in a pedigree, squares are males and circles are females. Oftentimes the pedigree will use some shading to indicate who is affected with a condition. Lines are drawn to people who are no longer with us. And so you can see this person here, I think you can see my pointer, is a man. This is his sister, his dad, his mom, his aunt, his uncle, his cousin, etc. So it's a way for us to determine patterns in your family. So if you do decide to go to a genetic counselor, there's many things that you can do to get the most out of your appointment. And this website, findageneticcounselor.com, is a great resource for people who are thinking about seeing a genetic counselor or having genetic testing. It's helpful to come to the appointment with your questions written down, information about your own health history, your family history, as well as lifestyle factors, which will depend upon the reason for appointment. So in a cancer setting, for example, oftentimes they'll ask when your last colonoscopy or your last mammogram was. Have you ever had an abnormal pap smear? In a neurology setting, it might be that they'll ask you if you've ever had seizures or any imaging or tests done by a neurologist. So having that information about your medical and family history can be quite helpful. And a lot of times the office will send you a form to fill out prior to the appointment. So before I move on to genetic testing, are there questions people had about genetic counseling in general? And I can't see the chat, so if there are questions, feel free to.
And if they pop up, Lauren, then I will also let you know. Currently, we don't have any in the chat, but feel free to.
I see one flashing thing, but it might be unrelated.
Okay, this is from Linda. Is genetic counseling often covered by insurance?
Yeah, that's a great question. So it will depend upon your insurance carrier and the reason for the appointment. Genetic counselors, regardless of how the service is delivered, work with administrators in their department, which would be able to figure out if there would be any cost to you to have the service. Many genetic testing companies also offer genetic counseling as part of their service if you're having a genetic test.
And no other questions so far. Linda says thank you. So obviously we answered her question.
Okay, so now I've mentioned the word genetic testing a couple times and realized that people might have various understandings about what that means. So I wanted to go over what I mean when I say genetic testing and where we are at this point. I think this is one of the most exciting aspects of the field is that even in 15 years, what we've been able to learn about our genetic material has grown quite substantially, quite quickly. And so I don't know how many people have a bio background and how people feel about biology, but I'll keep this part brief. But just to say, our body is made up of millions and millions of cells, and inside the cells, our genetic information is in the nucleus of the cell, in our chromosomes. And so you can see one chromosome here. If we zoom into our chromosomes are made up of our DNA. And segments, so little pieces on those chromosomes, are genes. And so we have over 25,000 genes in our body. It is still a process to really even understand what all of those genes do. And so we are learning more and more and more each year that goes by, but there's probably still more to be learned than we know currently about how all of our different genes work together to make us healthy. Another way to think about how our genes and chromosomes and genetic information all relate to each other is to think of them like a library. And so the library is like the cell. And inside the library, we have collections of books, which are like our chromosomes. And then specific chapters of those books are kind of like our genes. And so sometimes there can be mistakes or typos in those genes that cause the genes not to work correctly. But there also can be bigger changes, like maybe there's a whole book missing from these set of encyclopedias, or whole chapters ripped out. So there's various ways of looking at this genetic information to figure out if there are any changes. And so each test is only able to tell you what we sought out to do. Not every test is going to look at the level of typos. Some tests are only looking to see how many bookcases are in the library. And so this is zoomed in to see what if in all of our cells, we all have our chromosomes. And so we all should have 46 chromosomes. And here they're nicely arranged for us in pairs of 2, from the biggest to the smallest. And so the reason that they're in pairs of 2 is because we get one from our mom and one from our dad. And the last pair is what determines if we are a male or a female biologically. So this picture is a male, they have an X and a Y. And so if there are any extra or missing chromosomes, that can cause health problems. So the most common would be Down syndrome, where instead of 2 copies of the 21st chromosome, there's 3, which is called trisomy 21 for 3 chromosome 21s. So there's tests that can just look at this picture of chromosomes to tell us broadly, are there any extra or missing? There are tests that can look in more detail at the chromosomes to look for tiny missing pieces or tiny extra pieces that we can't see just by looking. That's called a chromosome microarray. And then there's tests that can zero in on a specific gene, looking at the DNA level. So maybe we just want to look at the gene for cystic fibrosis, for example. Maybe we know exactly what page this typo is on, and we don't even need to look in the whole chapter because someone in the family had the disease. So it's possible to look for just one single change in a single gene, or it's possible to look at the whole thing. Now, with new technology, it's possible to read along all the genes in the body, and that's called whole exome sequencing, and that's able to tell us about all of the information in someone's genes. Before I go through the different possible results of genetic testing, I thought it would be important to just go over different ways that the testing can be done. So the most common ways genetic testing is done is by taking a blood sample from the person, or the person can spit into a tube. So nowadays, with less people coming into the doctor's office, more and more testing is just being done with a saliva sample. If anyone has ordered genetic testing through a company like 23andMe, you probably spit in the tube like this. But genetic testing can also be done on pregnancy. So there's various tests that can be done when an individual is pregnant to tell us information about the growing baby. Tissues, so it's getting more and more common if someone has cancer, that genetic testing will be done on the cancer cells, and that testing can help determine what the best treatment would be for that person. And lastly, embryos. So some families may choose to or need to use in vitro fertilization to get pregnant when the egg and sperm are joined outside the body in a lab. And there's testing that can be done in a very early stage to test for genetic diseases that run in the family or are very common. So for the rest of what I'm talking about, probably be focusing on more of blood and saliva tests that you can have for a variety of reasons. But just keep in mind there's lots of different reasons for genetic testing, and it would be hard for me to go through all of them today. So the reason for genetic testing can vary. And so if you are considering a genetic test, it's important to think about, well, what is the purpose of this test? So the first type of testing is diagnostic. So this is someone who already has a health problem, and you're doing this test because you're hoping it can explain why they have it. It's possible that it could impact their treatment, but the test results could also be helpful to inform other family members about what their risk is of having that same disease. So an example is in the ALS clinic I work in, we can diagnose someone with ALS by their features they have and how their muscles are working by the neurologist. But patients we know about 10% of ALS is caused by a change in a gene. And so we do that testing on all of the patients in our clinic, because if we found a change in a gene, there's research going on that is looking at treatment that is based upon the genetic change. That's still in its very early stages. But importantly, other family members who are at risk can consider having testing for that same change. And so when one of those healthy family members knows that there's a genetic change in the family, and they consider testing for that specific change, that's called predictive testing. So that's when someone healthy knows there's a risk in the family. If they find out that they have that same risk, that same genetic change, they're at high risk. For some people, they want to know that information. So that would be predictive testing. There's lots of factors to consider when having predictive testing. How is this going to impact me emotionally? If I know I inherited this change that puts me at higher risk for ALS, am I going to be able to live my life happily? Would I only want this if there was a treatment I knew I could have? How will this impact my decision to have children? Would it impact where I work? Would it impact how I can sleep at night? So the genetic counselor can really help someone navigate all those important topics to help someone decide whether they should have that test. And then the middle category is screening tests, and this is getting more and more common as the technology advances. So this is testing that's offered to the general population or certain populations, and not because of a specific symptom or diagnosis in either yourself or your family. And the purpose is to tell us, is your risk high or low? So all babies, for example, when they're born, have something called the newborn screen, which looks at a variety of conditions. Many of them are genetic. It's done for everyone. In pregnancy, many women have testing to tell them if their chance is high or low for the baby to have Down syndrome. But importantly, many of these advanced genetic tests, so if you did like 23andMe, for example, that's more of like a screening test, because there's no way to give you a 100% answer on anything unless you're in the category of predictive testing, where we know exactly what you're looking for. So a lot of these tests done without a clear condition in the family are basically tell you if your risk is high or low. And it's important to have other family history, personal history to interpret the results of those tests correctly. And so when you're considering a genetic test, it's important to know, what will this test tell me? So sometimes, especially as genetic tests get bigger and they're telling us about multiple volumes of encyclopedias, not just one chapter, it's possible that the test may tell you information that you're not expecting to get back. So maybe you're having the test because you're concerned about cancer, but all of a sudden this test comes back telling you you're at high risk for Alzheimer's disease. So you want to make sure going in that you fully know the different possibilities of the results. Who's going to tell you the results and how will you get them? what would happen based upon each result. So if the test shows this, what would my next steps be? Would the results impact anyone else in my family? Is there someone else better to test? How will the data be shared? So I don't have a lot of time to talk to you today, but there are companies out there like 23andMe, Ancestry.com, where you can send off your saliva sample outside of going to a doctor and get back your genetic information. Many of those companies sell the data to other people, which is in the fine print. So it's certainly important to read the fine print thoroughly and ask those questions about where your data will be going. And someone already asked about insurance company coverage for genetic counseling. Anytime you have a medical procedure in these times, it's important to understand what the cost to you may be.
And Lauren, we did have another question. Do you need to have a primary doctor order the genetic test?
Not necessarily. So it depends on how your insurance is set up, whether primary care doctor needs to be involved in that. And it really depends on the genetic test and how complex the situation is. So some genetic tests are done more commonly where a primary care doctor or an obstetrician might be feel comfortable doing it, and others that are more specialized, you might want someone who has more specialty in genetics.
Great, thank you.
Okay, so one important thing to think about for the people having predictive testing and the people having screening testing. So people who are healthy and doing genetic testing to tell them more about their genetic risks. So there is a federal law called the Genetic Information Non-Discrimination Act, or GINA. And what this law says is that your job, in the vast majority of circumstances, there are some exceptions like very small companies working for the military or Indian reservations, but in general, your employer can't say, well, you had this genetic test that showed you have a higher risk to get Alzheimer's, so we're not going to hire you or promote you. That is not allowed under this law. Similarly, your health insurance company cannot say, we're going to not cover you or charge you a higher premium because of a pre-existing condition. This does not cover people who are symptomatic. So if you have symptoms of a condition, then that falls into the Americans with Disabilities Act or the Affordable Care Act. Importantly, these laws don't apply to long-term insurance, life insurance, or disability insurance. So if you're a healthy person and thinking about having a genetic test, in some cases, it's important to think about making sure you have the coverage for long-term care, life insurance, and disability insurance that you want. Because if you have the genetic test, and even though you're healthy, the genetic test shows a higher risk for certain conditions, it could influence your ability to secure those insurance plans or the premium that you're offered those plans for. So the possible results of genetic testing, so there you can get a positive result. Sometimes the positive is unexpected. So if you're doing a very broad test, you might find out information you didn't even know you could get from that result. But basically that means a change in the genetic information was found, and we know what that change means and what to tell you about it. The other option is negative. So that means that no genetic changes were found. That doesn't mean that there's no genetic changes. It really depends on what the test was, how thorough it is, and the quality of the technology. The test can only give you 100% reassurance in the cases of a true negative. So that's a situation where, say, I'm having testing because my dad has a gene change associated with hereditary Alzheimer's disease. I have testing for that exact change that my dad has, and I don't have it, which is great news. That means my risk for Alzheimer's, assuming there's nothing else in the family history, is the same as the general population, and I can be reassured that I didn't get that change my dad has. Importantly, if dad hadn't been tested already, we wouldn't be able to say that as concretely, because you wouldn't know if I did the same test in dad, would his results even find the change? So it's always best to test someone who has the condition you're worried about, because that makes the results more helpful for other family members. And then the last result is a hard one for both genetic counselors and for patients, is a variant of uncertain significance. So because a lot of this technology is new and we're still learning more and more about our genes, sometimes changes can be detected in the genetic information, but it's not clear whether that change is just normal variation or whether that change is related to health problems. And so it's kind of in the middle, and what you do with that will depend upon your personal and family history. And generally, those variants may be put into the negative or the positive category once more information is available. Okay, and so in our last couple minutes, I was going to share an example to kind of make some of these points more clear. So for example, let's say the patient is a 35-year-old woman and she goes to a genetic counselor for the most common reason right now is her family history of cancer. And so here's the diagram of this lady's family history. So here she is with the arrow, she's the circle right here. And we can see that her father had prostate cancer at 65. Her mom, or her dad's sister, her paternal aunt, had ovarian cancer at 52. And then her paternal grandmother had bilateral breast cancer, so on both breasts, at 49. And she died from unrelated reasons by 53. And then we're seeing on this side of the family that her mom's mom, her maternal grandmother, had breast cancer, but later on in life. So looking at her family history, the genetic counselor would probably say that the cancer on their dad's side is more concerning for a hereditary form of cancer, which is a common misconception that hereditary breast and ovarian cancer can only be from your mom's side, but actually it can be sometimes inherited from your dad's side. And so to explain a little bit more about how these cancer genes work, so actually all cancer is caused by changes in genes. They're just not changes in genes we're born with. And so if you picture here, to make it simple, you have two genes, you get one from mom and one from dad. And over time, let's say one of those genes has a change in it and it's causing it not to work correctly. And maybe the job of these genes is to keep cells growing at the way they should. But now this one stopped working, but that's okay. We have this other one to keep things under control. But then over time, we might have another change. And then this cell doesn't have any control, and that growth may lead to cancer. People who have hereditary cancer start off at this step. So they're born with a change in one of their cancer genes, which means there's one step closer to getting cancer. So that's why people who have hereditary cancer in their family, we see more cancer, and we see people getting cancer younger, because for people without this, it can take longer for all these steps to occur. And so there's many, many genes associated with hereditary cancer syndromes. As I said earlier, based upon, it's always good to test someone who's had cancer first or had the condition. So in this case, her dad's actually the right person to test because he has prostate cancer. And let's say that he went to a genetic counselor and he was found to have a change in one of the common cancer genes called BRCA1. This is the one that Angelina Jolie has, if anyone followed that story. And so because her dad has this change, the daughter has a 50% chance to have the same change. Now she comes back to the genetic counselor and we know exactly what to look for. And she has a test and she doesn't have this change. And this is really good news for her because we know that people who have BRCA1 changes can have a much higher risk to develop breast or ovarian cancer. But because she doesn't have it, we don't need to offer her additional screening. She can have mammograms at the rate the regular population does, and she's not at increased risk. So what if the story was different and she did test positive? So she was found to have the same change for her dad. Well, the best time to learn this is when you're young and healthy, because now knowing this, we can offer her more screening. So women who have a change in BRCA1 are offered breast MRIs and more frequent mammograms. Women are strongly recommended to consider having their ovaries removed after they're done having children, because we don't have a great screening test for ovarian cancer right now, so it's often detected when it's too late. So that's a decision that could greatly reduce the risk for ovarian cancer. And some women, depending upon their risk, may consider a surgery to remove the breast tissue and therefore lower the risk of cancer. But this seems like a whole lot. Well, why not just test her and not even get her dad involved in all this? Well, there's many, many, many cancer genes. And so what if we pick the wrong gene and his test was negative, and so we didn't know, we tested her for the wrong gene and her test was negative, we would have falsely reassured her that there was no risk when we just tested her for the wrong gene. And if we tested her for the right gene, then we're putting her in an awkward situation where her positive result likely means her dad is positive too. And so how is she going to navigate telling her dad about this information? So it can be a lot to handle your own positive result and then have to think about how you're going to tell family members whose health is also impacted by the result, and it likely means they gave it to you. So I know that many of you have an interest in neurologic conditions. So, you know, there's predictive testing available for many neurologic conditions, like ALS, which is the clinic I work in, Alzheimer's disease, Parkinson's disease, many ataxias. Huntington's disease is the exception of the group that is solely related to genetics. But for this whole group of conditions, there's a variety of genes involved. It can be a really big decision for families to decide whether they want this information or not. One really exciting thing in the world of neurology is that clinical trials are slowly moving in the direction of treatment, where if we know that someone has one of these genetic changes, say putting them at risk for ALS, then maybe there's a medicine that can be administered. Right now, the clinical trials are through the spinal fluid that could slow the progression of symptoms or maybe stop them from happening altogether. It's hard to say what the outcome of those trials will be, but certainly as a whole, the community is hopeful that the genetic information might advance us into better treatments. Just like in cancer, there can be treatments directed to the genetic change to keep people, to help people live longer than they would have prior to those treatments. So I'm happy to send along the slides, but a few helpful resources. The National Society of Genetic Counselors has great information and a tool for where you can find a genetic counselor based upon different specialties, as well as another tool called Find Information About Genetic Counselors, which can give you information about genetic testing and questions you might want to ask. And then Medline recently added a section on genetics, and genetics can be really confusing even for people with graduate degrees in genetics. So this site, I think, does a good job of reviewing some of the terms and types of genetic testing and genetic conditions out there. Feel free to reach out to me with any questions. I know we kind of gave a very broad view of genetics, genetic counseling, but hopefully this gave you some helpful information for yourselves and your family members.
And Lauren, we do have another question. And for all attendees, we have about 5 to 10 minutes left, so feel free to add any more questions that you have to the chat. One question is, what type of test do you do for Alzheimer's?
Yeah, so in terms of genetic testing?
Pat, would you like to expand Your question, what type of test do you do for Alzheimer's? Yes, for genetic testing.
Yeah, so it's going to depend upon the circumstances. So there's some genes that have a very strong association with early onset Alzheimer's disease called Presilin 1. So if anyone's seen the movie Still Alice, it's a fictional story based upon a family with a hereditary form of Alzheimer's disease. And in that form of Alzheimer's disease, if you have the genetic change, there's a very high likelihood that you will develop Alzheimer's disease and develop it early. Whereas there's another change that I think even 23andMe and some of the at-home companies offer called ApoE4. And so that is more of a marker that can adjust your risk. But people that have that genetic change don't necessarily go on to develop Alzheimer's disease. In fact, most don't. And so that tends to be more of a risk modifier and to tell someone if they're higher risk or lower risk, whereas some genes associated with Alzheimer's have a much stronger hereditary component, but those tend to be Alzheimer's disease happening at a much earlier age. The only other thing I'll add is that Alzheimer's is a difficult diagnosis to make in that it's often based upon symptoms. And so sometimes the symptoms of dementia can overlap with other hereditary conditions. So many genetic counselors involved in offering testing for conditions like Alzheimer's do work together with neurologists so they can give very detailed information about what symptoms they're seeing.
Okay, great. Thanks, Lauren. Is there any other questions? Okay. Thank you. They're saying it was fantastic. That was a lot of great information.
Oh, good. Hopefully you guys got a master's degree in genetic counseling in an hour. So best of luck to all of you. I appreciate the invitation and certainly feel free to reach out if I can be helpful in any way.
And we will send slides to everyone as well.
Okay, great. I can email them to you in a moment.
Okay. All right. And so I'm going to reclaim. Thank you again, Lauren.
Hi, nice to see you.
Good to see you as well. We look forward to our ongoing relationship with the Genetic Counselor Program at Emory as we are moving in the direction of providing genetic testing at our lab here in Snellville. So for more information in regards to McKinley Labs, you can go to www.mckinley, McKinley.ga.com. I'm going to run over to the chat because it looks like, oh, no, it's just great info. So great. Thank you very much.
Best of luck. Have a good day.
Have a good rest of your afternoon.
Okay, bye.
That's it.